So, you just got out of the hospital, huh?
Yeah, they patched a hole in my stomach.
Oh, you had surgery? You look good. You bouncing back quick?
So far, so good. Knock on wood.
That's a lot of medicine. Is that all from the surgery?
Not all of it. Some of it is. A lot of it I was already taking. I guess it's all right to keep taking it all.
I bet it is. Those doctors are pretty smart about that stuff.
I hope so.
Yeah. So, this is a lot of information. Probably just some lawyer discharge stuff.
Well, they said my discharge plan would be in there with changes to my care plan. There should be something about recuperation symptoms and side effects.
Side effects? Like what?
I don't know.
Well, I'll take a look at it later. So you want to get outside for a walk?
I don't think I'm supposed to get up yet.
Okay, well, you let me know when you're ready.
During the days, weeks, and months after a hospital stay, your client may be dealing with a range of new conditions and even some physical discomfort.
So, I read through your care plan and I talked to your daughter. You had an ulcer, huh?
Yeah. They patched a hole in my stomach.
Well, it looks like you responded pretty well. I mean, your vitals are great and the bleeding stopped, so.
Yes, so far so good.
Yeah.
Knock on wood.
Well, your care plan is pretty thorough about what your recovery should look like and also what the red flags are. We'll track your symptoms and your progress and make sure you're on the right track. But like you said, so far so good. So I'm impressed.
Red flags? Those are never good.
They're just warning signs is all. And if we catch them early and take care of them, you'll be on the right track for recovery.
Like what?
Well, you want to talk about that now? I mean, you must be exhausted.
I kind of like to, yeah.
Okay, sure. Well, there are a few common things that we need to watch out for. We'll watch out for pain and infection, of course. You have a small incision, but I'll need to keep it clean to avoid infection. So any discomfort you're having can make it hard to breathe deeply. Even lying in bed can make it hard to breathe. And that can lead to pneumonia, which is also an infection. Older adults are at an increased risk of infection due to weakened immune systems.
So what do I watch for?
Well, we'll keep an eye out for extreme tiredness, coughing, and shortness of breath. I mean, you're gonna be tired out naturally after a surgery, but your energy should increase over time, not decrease. So I'll try to get you out of bed as much as possible.
I've had enough moving around for today. Just getting home.
Well, maybe not today, but soon. We'll also keep an eye out for urinary tract infections too, which can be caused sometimes by dehydration. Older adults don't get thirsty as often and can become dehydrated, especially after surgery.
What are the signs for that?
Well, urinating more than usual and having discomfort while urinating, those can be signs. Also confusion too, just like with other infections. So I'll make sure you get plenty of fluids and track how often you go to the bathroom, but you let me know how it feels when you go, okay?
Okay.
All right, let's see. Heart disease. So you're taking medications for arrhythmia?
Yeah, for a couple of years now.
Okay, well, it looks like your doctor cross-referenced with your new meds, so nothing to worry about there. We'll keep your diet low in salt and watch out for swelling in your feet, legs, and belly. And it looks like you're getting weighed every day at 9 a.m., so we'll keep that up too.
So no changes there?
Nope, just keeping an eye on things.
Good.
Okay, so the last thing is stroke. You probably know about that.
I've known a few people who've gone through that. It was tougher on some than others. My friend Rick, he said he first knew he was having a stroke when his face suddenly became weak. He's doing pretty good now, but he still has trouble moving that side of his face.
Exactly, and if that happens to you, we'll call 911 immediately. The sooner you get treated, the better.
That's a lot to worry about.
Well, you don't need to worry. You need to rest. I mean, these are all possibilities, not likelihoods. As long as you rest, keep up with your medications, and get up every once in a while, I think you're gonna be just fine.
I hope so.
I know so.
I think I'm ready for that rest part now.
Good.
You mind if I take a rest?
Please. I'll check on you later, okay?
Because of the hospital stay, your client's medications may have changed. They may have new medications to take or old medications to stop taking. And their new medications may be long-term or short-term. Coordinating the new and old prescriptions can be very confusing. You can help your client take their medication correctly by picking up prescriptions from the pharmacy and making sure the orders are properly filled. It's your job to read medication labels closely to check dosages and directions. Some medications need to be taken with food, others on an empty stomach, and some should not be crushed or put into liquids. So check to see if there are any specific restrictions.
Hi, Walter. It's 3 o'clock. Time for your medication.
Really? Already?
Yep, already. So these need to be taken on an empty stomach, and you need 2 of them.
At least I can read it.
I asked for the large type on the label.
Thanks for that. Do I chew these?
You swallow those whole.
Watch closely to make sure your client takes the medications exactly as the doctor ordered, helping them as needed. Use a log to document the types of medications taken throughout the day, especially if the medications are for a symptom like fever, sleeplessness, or pain. Check the labels for side effects.
You don't feel warm. How's your stomach? Nausea? Do you feel like you want to vomit?
Nope. I just feel like going back to sleep.
Okay, well, your mood is good and you're resting well, so that makes me happy. I'll wake you before dinner, okay?
Sounds good.